Hey guys, I'm with Dr. William Rittmeyer, one of our interventional pain fellows. He'll be graduating, is it July of this year?
June 30th.
June 30th. Okay, he's counting down the days. But without further ado, I just wanted to introduce Dr. Rittmeyer and share with us what you want.
Thanks for having me, Dr. Suvar. Um, yeah, I came from Milwaukee, studying anesthesia in Milwaukee, down here for the, in my opinion, the premier pain fellowship in the country. And have always wanted to approach patient care in a more holistic manner. And I felt that a career in interventional pain was the best way to do that. It is equal parts interventional as it is conservative management, managing medications, helping people with their therapies, and developing these relationships with with your patients that don't compare really to any other specialty. And I see day in and day out cultivating relationships with the patients, the doctors, the other medical assistants that work here, and it's such a phenomenal career. I'm so happy I haven't started looking back, and I'm looking forward to a long career in it.
Yeah, I also want you to kind of share with us, the route that you took. There's a lot of, different ways to get to pain management, but you took the anesthesia route. But now you're looking at jobs, and I believe if we're at liberty to discuss that you did sign, right? Congratulations.
Yeah, thank you. With Advocate Condell.
Yeah, great. So I'm looking forward to the great things you'll be doing. But was it easy for you to let go of anesthesia? Is that something that you're going to think about moving forward?
I um, I still plan on doing some anesthesia from time to time. I think it's a skill that you've invested 4 years of your life, and that's a long time to invest in honing in your skills as an anesthesiologist. And first and foremost, I will be an anesthesiologist throughout my career. Um, so yeah, it's sad. Anesthesiology uh, is a fun profession. It's a rewarding profession, and I'm gonna miss being in the operating room more frequently in the shoes of an anesthesiologist. But I think equally as enjoyable and rewarding will be this career in interventional pain, and I think that they complement each other very well.
Yeah, I agree. And you know what they say, once an anesthesiologist, always an anesthesiologist, right?
Absolutely, absolutely.
Um, Before I leave our listeners, give us some advice on to as to what you would kind of pass down to the generation beneath you, people who look up to you. What would you kind of give them in terms of advice?
I think I think when I was in college and medical school, one piece of advice um, that I recall vividly is to be patient. You can't spread yourself too thin. You have to kind of think and act in the here and now. You want to set yourself goals. You want to be goal oriented, but you don't want to get ahead of yourself because it can become um, really aggravating and difficult if you're spreading yourself too thin. And that goes with anything in life. When you're studying, pick pick a way to study and don't deviate from that path. In your personal life as well, but in choosing a specialty, um, be open minded and enjoy what you're doing and uh, and live in the moment.
Thank you for sharing all those pearls. I appreciate that, Dr. Rittmeyer. So, guys, William Rittmeyer, thank you.
Yeah, thank you for having me, Dr. Suvar.